Welcome to Making Prevention a Core Element of Our Response to Homelessness. This is the first webinar in a mini-series exploring shelters as a public health setting. My name is Susie Taylor, and I'm a Knowledge Translation Project Manager at the National Collaborating Centre for Infectious Diseases. The NCCID is situated on the ancestral lands of the Anishinaabe, Anishinaabeg, Dakota Oyate, Denesalin, and Nehethawak and Innuit nations. It's also the homeland of the Métis Nation. We're on Treaty 1 land, and we recognize this and other treaties that have been implemented as part of a process of colonization that's been intended to benefit some while harming others. The effects of colonization can be seen today in various ways, including the disproportionate experiences of houselessness and shelter use by Indigenous peoples. This webinar series has been prompted in part by our reflection on the Truth and Reconciliation Commission's calls to action, particularly 18 and 19, and the calls for justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls, particularly 4.1, 4.6, 4.7, 16.19, and 18.25. I'd like to encourage everyone in attendance today to reflect on how these calls for action and justice relate to the topics we discuss as we work together towards reconciliation. For some housekeeping, we'll have some time for questions at the end of the presentation. During the presentation, you can pose questions using the Q&A tab at the bottom, and they will be moderated at the end. If you'd like, you can like questions, and that way that kind of pushes them up in the queue. We'll respond to as many questions as possible, but we may not be able to get to all of them. Neither myself nor our speaker today have any disclosures to make. I'd now like to introduce our speaker, Dr. Stephen Gaetz. Dr. Gaetz is a professor in the Faculty of Education at York University and is the director of the Canadian Observatory on Homelessness and the Homeless Hub, an innovative web-based research library which is internationally recognized as a leading example of innovation and knowledge mobilization. Dr. Gaetz has published extensively on the subject of homelessness. His research on youth homelessness, prevention, and models of intervention have contributed to significant change in how we respond to homelessness in Canada. In 2015, he was appointed to the Province of Ontario's Expert Advisory Panel on Homelessness, and in 2017, he played a leading role as a member of the Government of Canada's Advisory Panel on Homelessness. Dr. Gaetz, welcome.
Thank you. Thank you. I'm looking forward to this webinar. I love the topic of your whole series. So it's good because we need to take more of a public health lens to homelessness, as you will see. So I'm going to go through a presentation. There'll be time for questions at the end. And we'll go from there. And so we'll start with the problem we're trying to solve, right? So I think this is something that I've believed for a long time. There are three things we should focus our attention on. First is with regards to homelessness. The first is addressing the first is preventing homelessness from happening in the first place. The second is we need an emergency response because even with good prevention interventions and policy, it's likely that some people will slip through the net and become homeless. And then the third is focus on housing, stabilization, and supports. So these three should work in tandem, but historically they don't at all. This is more of a model of how things work in Canada and the United States, where you see that much of the resources and effort go into the emergency response. So that does include emergency shelters, but also day programs, soup kitchens, and the use of law enforcement to address what is essentially a social and economic problem. Very little historically has been done in the name of prevention, even though in places like Ontario, the province calls its homelessness funding strategy the homelessness prevention strategy. And there's nothing about it that's preventive at all. And then in recent years, we've seen more focus on housing and supports, particularly in the advent of the At-Home Shuswap project here in Canada, the largest research project ever done on housing first. And we've shifted in that direction, but it's important to note that that project kind of wrapped up about more than 10 years ago. And Housing First has never been successfully taken to scale in Canada, which is an important issue then in terms of implementation science. Why is it so hard to take effective interventions to scale? That's for another day. So anyway, in terms of progress in Canada on homelessness, modern mass homelessness started in Canada around the late 80s and early 90s. Prior to that, there were people one could describe as being homeless, but there was no homelessness problem. It exploded due to a whole bunch of, as a result of a whole series of policy decisions made at within all orders of government, most notably canceling our direct investment in building affordable housing, extremely affordable housing, social housing across Canada. And so here we are in 2024. It's already autumn. And where are we at in homelessness? So I'll just do a quick overview of some of the things we know. So Government of Canada supports doing national point-in-time counts every 2 years or so. They provide a snapshot of on a single day who is homeless, and then there are additional questions that can be asked that can be very useful. So the last one completed was an amalgamation of the 2020 and 2022 point-in-time count, an outcome of the pandemic. And so on the single day, over 40,000 people were enumerated as having experienced homelessness. The next, I'm not going to read all these bullets, by the way. The PowerPoint can be made available for you later. So I hate watching people read bullets, so I'm not going to do that, but I'll highlight a few things. The second bullet is an important one, that rather than decreasing homelessness, which has been the goal of the Government of Canada, it's increased for a wide range of reasons. And the biggest increase is amongst people who are considered unsheltered. Note the bullet at the bottom. This is really key, that Indigenous people remain overrepresented amongst those experiencing homelessness. They make up less than 5% of the Canadian population, but over a third of the homeless population. So we're in a place now where there's a lot of work to do. The government has committed to ending chronic homelessness, and the progress has not been great so far. And we'll discuss some of the reasons why. This is an interesting one I'm just going to mention briefly, because we're going to come back to the issue of youth later. So adults in the three categories on this table typically identify insufficient income for housing as the main reason why they're homeless. Whereas youth tend to talk more about family conflict and that kind of thing, which suggests that there are different causes of homelessness here, but also different solutions. Chronic homelessness is very high in Canada. You can see the rates for adults, older adults, and seniors being between 68 and 71% of the homeless population being chronically homeless. But the youth figure here, to me, is shocking. We're talking about teenagers and young adults who are already chronically homeless. So why prevention? So, to go back, this is how we're addressing homelessness in Canada, but it's well-meaning, but it's not as effective as it could be. A key thing is that our current response to homelessness, people will often say, well, we could do better, but how can we afford it? And it turns out that keeping people homeless is extremely expensive. We are spending a lot of money, but that's because our effort is focusing on helping people while they're homeless, not necessarily helping them not be homeless. And so Eric Latimer, he worked on the At-Home Swap project. He's an economist at McGill, did this study and found that the cost to public systems of keeping people in a state of homelessness for 1 year is very high. Look at the rate for Toronto. It's almost $60,000. Now that may shock people. It shocked me when I first saw that. But the cost isn't just the homeless shelter costs or that kind of thing. It's that when people experience homelessness, particularly for prolonged periods, their health gets worse. and their access to the healthcare system is typically through the emergency department, the most expensive gateway into the healthcare system. They're more likely to have longer stays in hospital because of the acuity of their illness, that kind of thing. And then the other thing is the engagement with law enforcement. We use law enforcement to address homelessness. People who are homeless are often very visible, and so the things they do come to the notice of the police, and then they get charged and wind up in jail. And a jail cell is the most expensive form of housing that we have. So if you thought if we could do things differently, in the long run, not only would we be doing the right thing, but we'd probably save a pile of money, and address some of the problems with some of our public systems that are overwhelmed in all kinds of ways. Okay, so here's another thing that I think is important. So right now, there is a kind of a formula for how to address homelessness, which involves some things that are really good, but are not sufficient to end homelessness. So the dominant paradigm involves taking housing first, which is one of the very few interventions for people experiencing homelessness that has any research base to it, any evidence base. But it's good. We know that it works. What we do is the formula here is to combine that with optimizing the homelessness sector to act on implementing housing first, and then focus on targeting the chronically homeless, prioritizing chronically homeless people. Now, and the idea being that if we do all of that bundle of activity and investment, we can end homelessness. We haven't, all of those things are important. I'm not knocking any one of them. I support all of those three things and the fourth goal of ending homelessness, but it's not sufficient. We've been kind of talking ourselves into believing if we just follow the recipe, everything will be good, but it's not. And I'll show you some data from the United States, which kind of highlights the problem here. So every year, United States Interagency Council on Homelessness, which coordinates homelessness strategy at the federal level, reports to Congress on a whole range of things. And so this is from the 2023 annual assessment report, looking at point in time estimates of homelessness. And so look on this chart here. The top green line identifies from 2007 to 2023 how many people are chronically homeless in the United States. And so you can see in 2007, the number is around 119,000. It dropped down to 77,000 by 2016, and then has gone back up again, now exceeding the 2007 mark. So, there's something's happening in the middle. That's good. Chronic homelessness was being reduced, but we've kind of bounced back in a negative way. And so what's the reason? I put it down to this. The reduction in chronic homelessness was tied to the reduction in veterans homelessness in the US. When Obama came to power, they invested heavily, billions of dollars, to end veterans homelessness, and they reduced it by about 50%, which is great. Like, that's the biggest progress made on any kind of homelessness. And so that's a success. But the problem is we can't generalize from that as to how we would solve homelessness, because here's the thing. In the United States, Veterans Affairs is its own integrated system. It involves housing, it involves income support, counseling, medical visits, hospitals, treatment. It's all there. And the government is able to direct Veterans Affairs to work with community organizations to identify veterans who are homeless and to help them. And so it's a great model, but we can't do that easily outside of an integrated system like Veterans Affairs, same as in Canada, right? It would be ideal if our hospital stepped up as part of the solution to homelessness, if the criminal justice system, if income supports, if all of these things were made to work as an integrated system, we could probably make more progress. But no government is willing to do it. Every government at the federal, provincial, territorial level could do something. They could put in the mandate letters which instruct different ministries about what to do to require that they use their resources to help address the problem of homelessness. But it has never happened in any government here. Okay, so the problem there is we're doing some really amazing things, but we're not ending homelessness. In fact, we're not coming close. And so what we've been arguing for a number of years, myself probably 15 years, where's the prevention in all this? To take it to a public health perspective, where is the prevention in our model of addressing homelessness? You know, this is what we see now, and we've all gone through a pandemic, and we've all come up close and learned a lot about how to address a pandemic, right? Everything from personal protection devices to isolating oneself, wearing masks, and of course vaccines. That all of those things, most people. There's some people who have we all know don't support any of this, but most people see the value in those preventive measures, including myself. Now, what would it look like if we addressed homelessness the way, or what would it look like if we addressed the pandemic the way we address homelessness? What we would have is very few personal protection devices, very few, ways for people to isolate. What we would instead do is spend a fortune on developing really large waiting rooms at the emergency room of hospitals. Add more chairs and more chairs and more chairs, and have people wait until they're sick enough to really get to the front of the line. And I think we can agree that that wouldn't make sense. And so we need to then switch it around. What if we address homelessness like a pandemic? And we would need the emergency rooms and supports, absolutely, right? But we would never build our whole homelessness strategy around emergency services. Can you imagine if our healthcare system was that the only place you could go to get healthcare is to show up at a hospital? That would not work. And, so we shouldn't do that. We need to think about it differently. And so the change we want to see with prevention is to move to something like this, where this is the focus of investment and activities, to something that looks more like this, where there's a balance. You still need your emergency response. It serves a very important service, but we need to invest more in getting people housed and supported, more investment in housing first, and we need to focus on prevention. But the question then is like, well, why hasn't it been a priority? And there's a whole bunch of reasons. There's resistance, we're facing a crisis, right? And so where should we put our precious dollars? And so obviously the attention is going to go to the person who's very ill and very homeless. Some people believe we need a mission focus, having only one priority, such as, ending chronic homelessness. People often, this always amazes me when people go, well, there's not a sufficient evidence base to support the prevention of homelessness. When, as I said earlier, very little in the world of homelessness has any evidence base. And yet when it comes up to something new like prevention, all of a sudden everybody's worried about the evidence base. Now, the truth is there is an evidence base, and that evidence base is increasing very rapidly in different places in the world, including Canada. Canada has become a world leader in many ways around preventing homelessness. Okay, this is a quote from a friend of mine from Australia. I love it. It's a good public health kind of message, have a read of it, and then we'll talk about what does all of this mean in the world of homelessness. So we're going to start with a definition, because I think if we can't agree on what something is, we'll get nowhere. So we need a definition of homelessness, which we already have. That's embraced by different orders of government. But what do we mean by prevention? So we've done a lot of work in this area over the last 8 or 9 years. This report on the left was our first stab at providing a definition of homelessness in a serious way and pulling together all the research and the roadmap for the prevention. of youth homelessness was one that focused on addressing youth homelessness through prevention. And so the starting place for thinking about prevention is to think about it as not just the responsibility of the homelessness sector. It's a fusion policy issue. There are so many parts of government that have a stake in solving homelessness, and there are so many parts of government that contribute to the production of homelessness. So we need to understand that, and particularly with higher orders of government, move towards more systems integration, getting other public systems as part of the solution. Now, the public health model of prevention can be adapted and is being adapted. That's what we're doing to address homelessness. So this is a very simple overview of the public health model of prevention. So, primary prevention means working upstream in order to increase population health and avoid illness or injury in the first place. So that's very important. We understand that. Secondary prevention involves interventions directed at individuals after an illness or injury and ensuring the condition doesn't worsen, but that it improves. So we understand that as well. And then the third is helping people to manage long-term complicated health problems or to avoid the recurrence. So let's frame that now in terms of preventing homelessness. So the primary prevention refers to reducing inflows into homelessness. In other words, stop people from becoming homeless in the first place by working upstream, by focusing on a whole range of things, which we'll get to in a second. The secondary prevention is to reduce the risk that those who have recently become homeless transition to long-term homelessness. So let's focus on that. And we're going to talk about that in a minute in more detail. That's where I think if we are imagining a stronger public health approach to emergency shelters and emergency services and supports, the secondary one is going to be really key. And then tertiary prevention is to reduce the likelihood that those who exit homelessness will return to it. So when we define what something is, we also have to define what it is not, because we know in the past, including with Housing First, that if you don't have rigorous definitions about what something is, and there's money on the table, all kinds of things come up that aren't really what the funding is intended for. So, what homelessness prevention is not is things like building the life skills of people experiencing homelessness, cooking programs, employment readiness, these kinds of things, without resolving their homelessness. Community-based programs and services that support marginalized people in general who may be at risk of anything or many things, but are not imminently at risk of homelessness. We have to target our funding on things that where the intended recipient is at high risk of homelessness or has recently become homeless. And all of the interventions have to have a housing component. You can't put someone in a program that doesn't resolve their housing and then claim it's homelessness prevention when they're still homeless at the end of the program. It has to involve housing stabilization. The other thing that's important is we need to really think about what does the prevention of homelessness amongst Indigenous people look like? What are the causes, right? There's a complexity there that is important to be mindful of. Our long history of colonialism and racism, which is ongoing, the practices that Indigenous people have that could be very preventive, that are preventive, need to be supported. There's a lot of knowledge amongst Indigenous people about how to think about prevention of homelessness in new ways that could benefit not only Indigenous people, but people who aren't. So we'll put that in the background. Now, we also have a typology of homelessness. It's got these 5 steps. I'm going to go through it quickly. Want to make sure there's lots of time for questions. So we'll start with the first one. Universal or structural prevention means working upstream to address underlying structural factors. And so here's a whole range of them. I think the research points out that number 2 is the most important. And explains why some cities have larger homeless populations than others. We have underinvested for decades. The population of the country has grown for decades, and we don't have deeply affordable housing. Even now with the National Housing Strategy, unfortunately, a lot of the investment is designed for people like me and my children, middle-class people. Now, that's important. I'm not saying we should disregard that, but we need much more of a targeted focus on building social housing, building deeply affordable housing, co-ops, that kind of thing. We know how to do a lot of that really well, and we've learned a lot over the years, but we have to make it possible that people who are at risk of or experience homelessness can benefit. So a key thing here, when we're talking about the homelessness sector, the responsibility to address structural factors isn't really theirs, right? It's other parts of government. It's all orders of government. That's an important thing. So systems prevention involves addressing how public systems can be transformed to support homelessness prevention. So this is a public health approach too. Like, who's responsible for this? So we know that people exit public systems often are discharged into homelessness. So people exiting corrections are often discharged with nothing more than a sheet of paper with some addresses of homelessness shelters and bus ticket. We know from research that if you discharge someone from prison into homelessness, the rate of reoffending increases, right? So rather than focusing on crime prevention or crime reduction, our policies are producing crime. People exiting mental health and addiction services into homelessness, whatever they were in that health center for will likely worsen if we discharge them into homelessness. And there's lots of good research. People like Cheryl Forchuk have done extensive work on this kind of thing. Why aren't we helping people at that point? And then youth leaving care is a huge issue, which we'll talk about later. But at this point, I just want to say, 0.3% of young people in Canada have had involvement with child protection. Amongst young people experiencing homelessness, it's 58%. So there's a pipeline, showed a pipeline before, from child protection into homelessness. That's a problem we can fix if we put our minds to it and fund it properly. And then finally, this gets at a broader problem with public systems. And we know from research, including on public health, that the problems and benefits that go with issues are not evenly spread. We saw that during the pandemic, that some subpopulations were more likely to get sick and more likely to have worse access to public health systems. So how do we make our existing infrastructure work more equitably for people who are facing discrimination and a history of problems with those very systems? So early intervention, this is working upstream. Here are some interventions that have a good evidence base. I won't go into detail, but just to let you know, if any of you are interested in any of these things, you can, let me know and I can point you to where you can find out more. The dominant approach is evictions prevention. So there's a lot of promising work going on in Canada on this, in the United States as well. It's very interesting work that involves like providing people with information at the right time, legal resources, flexible funding, if they're in arrears or this kind of thing. We're learning more about what to do, and this helps because if we just let people wind up falling into homelessness, things can get a lot worse before they get better. Crisis prevention. So this is the part where I think gives us an opportunity to reimagine what the emergency services are for. So we know from research that, say 100 people show up to an emergency shelter. Of that 100 people, about 80 will resolve their homelessness mostly on their own within a couple of months. And they'll exit homelessness, most of them unlikely to ever return to homelessness. So that's fantastic news, right? But it begs the question, what about the 20% who don't? What about the 20% who struggle and wind up becoming chronically homeless, which we saw the numbers before are quite high? What if we designed the whole emergency system to identify who is in that 20 to 25% group and put our resources behind giving them the supports they need so they can exit homelessness? What if that was their priority, right? And I've used to work in the emergency services myself, and I would say that many, if not most of the staff with a high degree of likelihood could predict who they think will become long-term homeless in that group of 100 people. So what if we remodeled the whole thing? So what do we know about ways to think about this? So there are key elements to this crisis prevention, right? So reduce dependency on shelters, which means it should impact on how we do intake, but also how we think about what the shelter's for. Minimize duration of homelessness is a priority. Make that a huge priority so that people don't get mired in homelessness. Make sure people have secure tenancy, so always have a housing solution tied to it, and target wraparound supports to those who are at risk of falling into chronicity. And these are a whole range of interventions that have been tested, that have some level of evidence base, some more than others, but that are ways that we could help people right at the point when they show up at the shelter. So things like diversion, helping people find alternatives to going into the shelter, host homes, cash transfer systems. They're doing a lot of that work in the United States right now with some pretty good results. And duty to assist, which is from the country of Wales, which I think is one of the most amazing structural solutions to homelessness that I've ever seen. So we know about that. And then there's other questions to ask in terms of the future. So that question about identifying of the 100 people who is likely to become chronically homeless, can AI help us to make sense of that, like to help us identify people? You can see here this newspaper article. They've been testing this model out in London, Ontario, and as well as other places. So they use currently existing administrative data. And imagine this. So you know who's chronically homeless. You have data on that. And you know who didn't become chronically homeless. And what are the characteristics of those two groups? How are they similar? How are they different? What stands out as being key factors that lead people to chronicity? And then as that kind of got refined going forward, it's possible that we'll be able to, like in real time, assess somebody using legitimate assessment tools that are properly designed, and then see if we can stop their homelessness. And the whole potential around linking administrative data is offering some real opportunities. And Canada has gone from not being very far along to like really zooming to the lead in what happens when we can integrate administrative data and link it, both in terms of understanding complex problems, because you can do longitudinal research without having to personally track people for 4 or 5 years. You can track them for 50 years. And also help us understand how people, what are the consequences of things that happen in people's lives and how can we mitigate them? So that would be a human-centered design approach. So housing stabilization, this is the final one. So how do we help people exit homelessness, never to return? Here are 3 interventions that are, the first and the third are at the top of the list in terms of evidence base in the world. These things work. People need housing, and they need stable housing and safe housing, and they need supports. So you may have noticed, and I'm going to be wrapping up within about 5 minutes. So get your questions ready. May have noticed that I mentioned youth a lot in this, and there's a reason. If we're going to focus on prevention, it's going to be hard to do a whole-scale transformation right off the bat. So what if we focused on one group? Young people who, as we saw before, many are chronically homeless, but when they're in the queue to get housing first, they will fall behind those who have been chronically homeless for 20 years. It's hard to be chronically homeless for 20 years when you're only 18, but you might get there, unfortunately. So why youth homelessness? So I'll go through some interesting data that we have on youth homelessness that's important. So we did a national survey in 2016 and then again in 2019. And one of the questions we asked was, how old were you when you first experienced homelessness? And interestingly, 40% said they were under the age of 16. And the characteristics of those who had the first experience under 16 is different from those who had it, the characteristics of those who had their first experience at 16 or older. And you can see in this box here, some of the characteristics of those who had that early experience. And this is unattached homelessness. So it's not that they're with their parents. And so that was perhaps the most shocking data we had from this survey, which had about 1,200 participants. I never expected that, but it's shocking because in the world of homelessness in Canada, we don't do anything for this group. There are no homelessness services for under 16, except I think in Alberta, there's a few things. There's nothing. Child protection is not the solution because people transition from child protection into homelessness. We leave them alone at our peril, and that should be a priority. Think about that. The next figure here, so this is the one around involvement in child protection. So we know that that public system discharges people at the age of, depends on the jurisdiction, but between 18 and 21. That might have made sense in 1960s when you could leave home at 18, get a job, get housing, work in a factory, that kind of thing. But it's not that way anymore at all. What is normative in Canada is for people between 20 and 25 to live with their parents. Over 60% do. And yet we have a public system that assumes that young people who have had very difficult and challenging pasts are ready to go out on their own and get a job and get housing when they're 18. It's such a sad story. A public health response would prioritize their health and needs and access to housing and supports of family. Young people, when they exit homelessness without proper supports, don't do well. They usually return to homelessness, chronic homelessness. Just want to remind ourselves of that one again. Then I'm going to mention one last thing. So in the 2018 point in time count, we asked them to insert the question around how old were you when you first experienced homelessness? So this is people of all ages. And what they found was that 50%, so half of all people who are currently homeless had their first experience before they were 25, so they were youth, right? And so this table here is my favorite one from 2022. And this drew from shelter data from Government of Canada. And so if you look at this table, this plots people at the age at which they first experienced homelessness. And you can see that the peak years for first experiencing homelessness are between 12 and 20, between 12 and 20. And so it's all starting to come into clarity. If we were to do a really good job of addressing youth homelessness and focusing on it through prevention, not only would we produce better outcomes for young people and their families and their communities, but we'd have a big impact on chronic homelessness. It'd be a paradigm shift because at this point, youth are not a priority in most communities. So the consequences of just doing nothing except applying a traditional emergency model is that For this group here between, 12 and 16, we do nothing. For those between 16 and 25, we have the crisis response. And all of this can be considered a pathway to chronic homelessness. So we're concerned to reduce chronic homelessness down to zero. And yet I would argue that our current response creates the very problem we're trying to solve. By not helping people with the right kind of help at the right time, this is what we get. So to wrap up, is there good news? Because one could say, well, this has been a nice presentation, but it's all bad news. The good news is this. Government of Canada has started to take homelessness prevention seriously. These are the 5 mandatory community outcomes areas that the Government of Canada has identified. And you will see that 2 of them focus directly on prevention. So communities are being told, you have to report on this. You have to start doing this. Other things, the Reaching Home directory and glossary. This is the documentation that Government of Canada does for any of their programs. The directives signal what are the government's priorities, what is allowable to do with government money, and these kinds of things. And so in the last year, they redid and updated their glossaries and the directives. And the good news is they're starting to really bake in a focus on prevention, and including identifying a number of preventive interventions that they stand behind. So that's great news. Things are changing in Canada. Things are changing in the US as well. This is the United States homelessness strategy launched in 2022, which was great because it had prevention all over the place written. But then last September, or this current September, which is also the last September, something else happened is they released their very first homelessness strategy. And we've looked through it and there's a lot of good things in there. So what it points to in Canada is we often look south of the border for our ideas on how to address complex issues. This is one we should take up. We can do something. Where are there some good examples of success? In Washington State, in the United States, they've done great work around youth homelessness. Look at this legislation passed in 2018 that, no youth discharged from a public system of care into homelessness will be allowed. You have to figure out how to stop it. That's so bold. We also know we have some good data on some interventions for youth that are preventive, and one is called family and natural supports. In the world of homelessness, the family is often seen as the problem or part of the young person's past. We feel that all young people should have meaningful adults in their life to help them navigate. Housing First for Youth is an adaptation of Housing First, but directed to develop address the needs of developing adolescents and young adults. And we've got outcomes data on it that is amazing. And so this took off in Europe faster than it did in Canada. So it's all good. And then I'm going to close here with a invitation to people. The very first international conference on the prevention of youth homelessness is happening in Toronto in next February, the 24th to 26th. It's going to be an amazing event, and it's going to, highlight the vast amount of research that's been done on preventing homelessness. So we can now open it up to questions. I'm going to stop that sharing, and we can go forward.
Thank you very much, Dr. Gaetz. It was a really interesting presentation of scribbling notes throughout. Zishan just put this in the chat, but feel free to send questions through the question and answer tab. And I'll maybe start it off with a question of my own. I was quite interested in what you were saying about the duty to assist in Wales, and I was wondering if you could speak a little bit more about what that involves and how that might look in a Canadian context.
Yeah, it's an amazing thing. So in Wales, I'm pausing because Wales is part of the United Kingdom, so they can't control everything through their legislation, but they had a right to housing, or have a right to housing, that's actually stronger than ours in Canada. But they weren't making progress on homelessness, outside of family homelessness, but they were really prioritizing and investing that. So they passed legislation in 2014, the Housing Wales Act, that a researcher, Peter Mackey, played a huge role in, which is great. Wouldn't every researcher love to say they influence policy? So here's how it works. If the local authority, which means the municipal government there, becomes aware that somebody is at risk of or is experiencing homelessness, they're required within 14 days to offer assistance. And if the person says, yes, I could use some help, they're required to resolve their homelessness within 2 months. And
Wow.
resolution is not a bed in a shelter, it's stable housing. And conceptually, I thought, oh, this is just incredible. And what's happened is they've seen their homelessness numbers drop quite substantially. It's bounced up a bit with the pandemic, but they're now, based on what they've learned, are introducing new legislation to update and upgrade it. And so when we were looking at what would this look like in Canada, we started to think, how would this work for youth? And so we thought, like, it won't work to have the responsible party work in a municipal government, because no young person is going to go, you know what, I need support with family mediation, I know just where to go, I'll go to City Hall. They're not going to do that. They're not going to go to a homeless shelter because they mostly won't consider themselves homeless. But if you take that human-centered design perspective, who might they tell? Right? They'll tell friends. They might tell their friends' families might know they're homeless. It might be a teacher, might be a nurse, could be a coach. You'll note that those are all public institutions outside of the friend-related ones that young people touch and engage. That's where you build in the infrastructure. Now, we wouldn't say teachers have to resolve the homelessness, but you can put together really effective youth support services that build in the family and natural supports work and the housing and all of that. And they partner with the schools, for instance, or with the nurses and talk about the causes of homelessness and what can be done. And then when that teacher, who in the past would maybe know that somebody's homeless, and I teach teachers in my grad courses all the time, and most teachers, if you know a teacher, ask them if they've ever known a student who they suspected or knew was homeless, and they'll say yes. So that's how we would do it, is make other public institutions draw them in to the whole question, right? Like, where are people likely to talk about being homeless? And then rebuild it. And if the person wants help, then you work with them and their family to help resolve it. And actually, based on being part of our conversations about that, in Wales, their new legislation is going to open it up. So it isn't just local authorities that have a responsibility to act, but others. There are other communities in Canada that are interested in adapting duty to assist, and including one Indigenous community that's looking at it as a way of helping support people who migrate from northern communities, right? So that there's somebody there, it's like a settlement service that will, the community can be mobilized to help people right away before people, have unfortunate things happen to them. So it's a kind of thing I wouldn't recommend copying exactly the way they do it, but the intent of it is brilliant. And I think we could do some really interesting work in Canada that would, again, have that preventive focus and that public health kind of lens to the whole problem.
Yeah, and that kind of cross-cutting piece between different institutions being
Yes.
involved and working together on the same problem, as opposed to it being kind of in silos, is very interesting. Thank you.
Yeah.
I see it. We've got another question in the Q&A here. So Peter has asked, is there federal funding available for provinces to apply for to support new initiatives to address homelessness?
They come up periodically. The way the federal government funds its homelessness strategy is they actually send the money not to the provinces and territories necessarily, but to what they call community entities. So these are governing bodies for the local homelessness strategy. And they currently make it quite flexible in terms of what people spend their money on. If people are, and so they make clear what kind of programs are fundable, but there's room for innovation there. Right now, they're funding, I think, about 20 communities across Canada to do more innovative work. So they've been really good on the innovation side. But federal funding makes up, depending on who's telling you, between like about 8 and 15% of what's spent on the ground locally. So provinces and territories spend a lot more than the government of Canada does, and so do municipal governments. And then there's also the philanthropic sector, that kind of thing. So there's opportunities at all those levels to get creative. And especially when things like Housing First for Youth, where there is an evidence base, there's things that you can do to implement things in a new way in your community. We know of some amazing Indigenous youth homelessness prevention programs. There is an Indigenous adaptation of Housing First for Youth that built the intervention around cultural connection and reconnection. So there's lots of really good things going on. Communities can do innovative things if they want. The language of the Government of Canada is that communities are given maximum flexibility in terms of how they address homelessness.
That's great. Thank you. I'm just checking to see, are there other questions from the audience today? I have lots more, but I might ask just, oh, wait, I see we've got one coming in here, sorry. So Julia has said, hi there, I work as a nurse at downtown Winnipeg. We find so many barriers for folks to work with. When a child is apprehended from their mother, we often lose contact with the parent as they associate us with their child they no longer have in care. They lose their 2-bedroom apartment that CFS mandates in order to reunify, and therefore they end up homeless. They lose touch with services, supports, and the cycle continues. We lack supportive housing for folks who use substances and are working to reunify with their children. Many facilities require folks to be sober, which is a barrier if the person isn't ready, if detox is full, if long-term treatment is full, or there are other requirements. And then these folks are stuck. Also, many of the folks we work with lose their place when they're going into treatment. Do you have any thoughts around this?
Yeah, thank you for that question. There's a lot there. You've identified a whole bunch of problems that are known, but we're not doing much about. I think the area of if I could just talk a minute around substance use disorders. It's always been fraught, the conversations about how to do this. Like you mentioned, you didn't use the language of harm reduction, but I think that's, it sounds to me like that's what you're understanding, right? That you can't force somebody into treatment who's not ready. Well, you could force them, but the outcomes will not be good. People need to be, you need to work with where people are at. People who do want treatment should have access to it, but not be forced to return to the place where they were before, where people were dealing drugs to them before. You know, like we need to be more creative, but it has to always be client driven, and we have to be wary of the claims that by doing harm reduction, we're either promoting substance use or, you know, that people, it would be better to only spend on treatment. Now, we should spend more on treatment, but that won't be sufficient. People who don't get treatment don't all, some people are able to resolve their substance use disorders, but many cannot without help and time and respect and safety, all of these things. So yeah, your comments, you had a lot of things that I think are really important to understand that are can be, like, where do we get more permanent supportive housing? Where do we get more access to housing? These the things that you're talking about, all of them have solutions, right? Like if we're sitting and talking about it, I bet you would be able to say, this is what we need. And if you talk to people who are experiencing public systems, right, people with lived experience, they're often able to say, this is what we need. We did this report on youth homelessness where we went across Canada and asked people to talk about when they first experienced homelessness. Did anybody know about it? And if they did, was there an intervention or something there to help you? And if not, what would it have looked like? What would the help have looked like? And, virtually every young person could tell you exactly, my mom lost her job and our car is broken down and the fights we were having just got worse. So I finally had to leave. Like, there's a story there, but within that story, there is like, wow, can't we help that young person? Helping the young person's mom might be really important, and paying for the new tires or whatever, like there's creative ways of supporting people. And we need to think about that. People with lived experience know a lot about what could be done better based on their own experience of what didn't help.
Yeah. Yeah, it's such an important piece, actually, listening to people when they tell you what they need, I think, and designing interventions based around that. We're almost out of time, so thank you very much. I really appreciate the interesting webinar. I have many, many more questions. I'll send them all by email.
Great.
And thank you to all of our participants for joining us too. There will be a short webinar evaluation that pops up when you leave, and a link to the recording will be emailed to everyone who registered through Eventbrite. The recording itself will also be posted online on nccid.ca after the webinar. And I'd also like to invite you all to the next webinar in this series. It's going to take place on October 23rd from 11 to 12 Central Time. And it's titled Adapting and Supporting Equitable Access to Primary Health and Social Services for People Experiencing Homelessness. The presenters for that will be Dr. Sarah Allen and Monica Rohrig. And then on November 6th, we're also going to have a third webinar in the series, as yet untitled, but it's going to feature Mary McGregor Pitawanakwat from the National Indigenous Women's Housing Network. And she's going to be talking in a bit more depth about the connections between colonization, homelessness, and public health. And last but not least, I'd also like to let everyone know we've recently put a podcast mini-series out on shelters and public health. And we've had some speakers, including Dr. Forchuk, who I saw you mentioned, Dr. Meyer, Dr. Regemacher-Schiff, and Dr. Rueda. So that's also available on our website. We can send that out via email as well. Thank you, everyone, for joining us. We really appreciate it. And thank you again, Dr. Gaetz.
Thank you.